Ministers have announced a crackdown on so-called cowboy cosmetic procedures. That includes plans to restrict who can actually provide these treatments. Rogue operators with no medical training whatsoever have left people maimed and injured after performing treatments including Botox, fillers, bum lifts in UK homes, in hotels and even, we've heard, in public toilets. The government hopes that the move will reduce the cost on the NHS to fix botched procedures. Between 2018 and 2022, the NHS spent £6.5 million fixing these procedures, and that is only on the ones that were carried out abroad. So is it fair for the NHS to spend your money fixing other people's botched cosmetic operations? Let's go. I don't know who to choose. I'm going to choose. Why don't I choose Marvyn? I'm sure he's an expert on this. What do you think about this?
No, so I do think the NHS have a duty to fix whatever issues arise within our borders, right? And then we do have to ask ourselves what allows these cosmetic procedures to occur. And the idea of going away and having tourist sort of procedures and coming back with issues is something that needs to be looked into. But we do have to look after people who are having botched procedures wherever they are, as long as they're British citizens and they're here. So it's a very tough one, but I think the proposed ideas around changing the allowance of these procedures will really help minimise how many there are.
So you mean fewer people who aren't qualified will be doing them, so there'll be fewer operations to go wrong.
But
it won't have any control over health tourism and people going off to Turkey and other countries to get operated on.
I think a gentleman died this week actually as a result
there are lots
of
stories like that, aren't there?
That he did in Turkey.
Tragic stories. Emily, what do you think about this? Because obviously people will be thinking, you know, if you can afford to fly to Turkey, or if you can afford to pay for a boob job, a facelift, a nose job, or whatever it is you're having done, you can afford it. So why on earth should it have to be the NHS that puts you back together if it goes wrong?
Well, I think the whole point about the NHS was set up obviously by Andrews Bevan was that, you know, everybody should be treated. There should be no one should be excluded because for any reason. That's the whole point of a free national health service. So I think that tenet is the thing, is the writing through the stick of rock, and that has to stand. You can't just, where do you draw the line? Do you say, oh, I'm not going to treat you for your lung cancer because you smoked 60 a day. I'm not going to treat you for your diabetes because you're, you know, 22 stone and you're still eating sweets. I think that the NHS has to treat everyone that comes through its doors. Yes, I can understand your point, Vanessa, as well made as ever, but usually these people who are having such bad procedures are probably because they're not as expensive as the top doctors or the top procedures. If you go to a reputable salon, I don't even know where you go, but
you get referred by your GP to a consultant in the NHS who is also doing cosmetic surgery.
Exactly. And if you have cosmetic surgery properly done, you go to a private hospital, you get referred through the NHS, and it's done properly. If you're having it a back street, you know, whatever, I mean, a public toilet, I'm flabbergasted. Scary. That's so scary. Then obviously you're probably not paying top dollar, and so therefore you're not going to have perhaps necessarily the best people. I think it's very key, as Marvyn just said. I think what is the way to the NHS has to treat anyone who comes through its doors. The key here, I think, is regulation. The Quality Care Commission is saying that they are going to crack down on more of these, you know, backstreet botched jobs.
But Sam, what if the NHS were to say, look, you paid for this operation, it's gone wrong, now you have to pay us for the corrective operation to put it right. You could afford the other one, you should jolly well stump up for this one. If you've spent all your money on your boob job in whichever country, or the one that's gone terribly wrong, then pay us in instalments, but at least pay us.
Well, we do limit some things like IVF, for example. You know, obviously you can't have free unbounded access to that. I do think it's very sad if someone has had a procedure where the proper things haven't been in place to protect them in the first place. But I personally would see no issue with if you've had a cosmetic procedure that wasn't like life and death. If you're in a life and death situation, of course we should treat you and help you. But if it's a cosmetic procedure that looks wrong or is wonky or is unpleasant, then I don't see any reason in principle why you shouldn't be asked to contribute towards the cost of sorting that out if you contributed to the cost of creating that problem in the first place if it's not life or death.
Although then we end up in trouble though, don't we? Because if you've been on a very expensive skiing holiday and you've had a horrible accident and you come back in plaster and you need corrective surgery on, you know, a broken limb or something, we don't say, well, you could afford the skiing holiday in the first place, it's your fault for doing a dangerous sport, you've got to stump up the money for this corrective surgery, do we?
But you didn't choose to have the accident. That was,
that's true.
There's a difference between the choice, and I'm not judging it in any way, but the expense of that is very sad and you don't want anyone to be in harm or pain.
Let's go straight to Tony in London, who knows all about this stuff. Tony, hi, thanks for ringing. What happened to you in America?
Well, basically, I wanted to have surgery, rhinoplasty.
Right.
And I saw one of the top surgeons in the UK, which actually a friend of mine has actually gone to, and she looked fantastic.
Right.
So I went along to him, and he took lots of photos, the usual thing. And he said, unfortunately, I can't help you. However, I know several people, well, 3 doctors who recommended in America,
Right.
who said he believed would really be able to help me. So
Can I just ask you, obviously we can't see you, Tony, so we don't know why you wanted a nose job, but why did he say he couldn't help you? Because that sounds quite unusual for a cosmetic surgeon to say.
Well, yeah, I do have a slight deformity, which can be seen, and also I had breathing problems,
Right.
actually.
So he said he couldn't help you, but you found
he
someone
said he
who
couldn't
said
help
they
me.
could in America.
Well,
and
he recommended 3 people in
Right.
America that would be able to help. So I went to see my doctor as well, spoke to my doctor about it, my GP, spoke to her about it. And I chose, she told me to choose the doctor. So I went to America and I saw all the 3 doctors,
yeah.
and then came back, made my decision, and spoke to my GP again about it.
Yep.
And she vetted the doctor I'd chosen, one of the top universities, Johns Hopkins University in America.
Yeah.
And I then went back for the operation.
So in other words, you're telling us you really did your homework, you did it the kosher way, you did it via the
Absolutely.
doctor. I get it. You really did your very, very best.
Absolutely.
But get to the bit where you had the operation. What happened next?
Had the operation. It was awful.
no.
Totally botched up. You've got to employ a nurse to stay with you in America if you have surgery. And had the nurse, and even the nurse was concerned.
And what
And
actually
anyway-
went wrong? What was wrong with it? What did it look like? What happened?
Well, I looked absolutely worse than when I'd started. I told you I had a slight disfigurement, and I looked worse, and my breathing problems were actually worse than they were before.
Oh, no.
I came
So,
back to the
so let me
UK.
ask you, did you have to have an operation to rectify it here?
Yes,
You
I
did.
did.
You
But
did.
I mean, unfortunately, I could afford to pay for myself.
Right. So
But
what do you
what if
think
you
about
can't?
this conversation then about should the NHS cover botched operations, cosmetic operations?
I actually think they should, especially if people have done their homework. But also, if part of the reason people go abroad, as one of your panel said, is because they can't afford the costs in the UK in the first place. I mean, that's not why I went abroad, obviously. But if they come back after a botched operation, they're going to have psychological issues, which we'll end up paying for anyway.
Also true. Tell me something. How do you look now?
Oh, now I look great.
That's the right answer. Oh, I'm so glad you look great. Tony, thank you so much. Thank you for the call. Let's go to Sharon in Staffordshire. What do you think, Sharon? You've heard Tony, you've heard my panel. What do you think?
Oh, good morning, beautiful Vanessa. I love that dress and your lovely panel.
Thank you.
No, Vanessa, no, I've heard Tony's story, and okay, he went to America, he can afford to pay for his botched job.
Yeah.
But no, it's not down to the NHS or taxpayers to pay for anybody's botched cosmetic surgery at all. You can make that decision to go abroad and get that done, well, you must have the money to pay for it when you get here. And another thing, Vanessa, we've got to remember that the NHS wasn't designed for that purpose. The NHS was designed not for people to go abroad and have cosmetic surgery and expect the NHS to repair it. No, there's people that need those beds, and they're occupying those beds for people that really need it.
So what would you have them do though if they come back and let's say
Well, I would
one
have them
boob
do,
is
Vanessa,
infected or something horrible like that?
What they should do, Vanessa, is take out insurance to cover if there's anything wrong,
Right.
or they should have the money to be able to pay for a botched job if it gets botched. That's what I think personally. You know, insurance, or you should be able to pay for it. Not expect the NHS to cover that. I'm a taxpayer. Why should I be paying for somebody else botched cosmetic surgery procedure?
How do you feel if somebody if somebody's on a very expensive skiing holiday and they have a skiing accident?
Well, that's different. That is an accident, isn't it? They didn't anticipate that happening, did they? No. So no, that's completely different. That is.
Fair enough. That's what Sam said. You're with her. Thanks, Sharon. Always a pleasure. Thank you so much.